Good afternoon, everyone. It's lovely to be here in this lovely sunny room on this great day. Before I make too many comments, I'm going to introduce you to the Island Health video that tells you all about the services that we provide, and then I'll come back and do better introductions.
Serving 885,000 people, Island Health's focus is the health and wellness of the residents and communities on Vancouver Island and in surrounding coastal communities. Our diverse geography spans 48 settler communities and 50 First Nations, from the Zawadenu people of Kincombe Inlet to Victoria, from Tofino to Comox. We acknowledge with respect and gratitude our privilege to provide health and care services on the traditional unceded territories of the Coast Salish, Kwakwaka'wakw, and Nuu-chah-nulth cultural families. The Island Health family includes 30,000 healthcare professionals and 1,000 dedicated volunteers. Over 3,000 doctors, nurse practitioners, midwives, and dentists make up our medical staff. We provide health and care services at 145 facilities with more than 6,700 long-term care beds, over 1,600 mental health and substance use beds, and more than 1,800 acute care and rehabilitation beds. Island Health has an annual budget of $3 billion. Each year, this funding supports 561,000 visits to emergency departments, more than 73,000 surgeries, nearly 60,000 MRIs, 158,000 CT scans, 2,100 telehealth visits, more than 85,000 visits to urgent and primary care centers, over 17,000 home health monitoring visits, 314,000 visits to ambulatory clinics, and 478,000 home health care visits each year. Island Health has expanded our primary care services with 23 primary care sites across our region, including 7 Island Health urgent and primary care centers and 9 primary care networks. Under the leadership of 6 medical health officers, Island Health works to promote health, prevent disease, and improve quality of life. Each year, we conduct more than 2,000 inspections of childcare facilities, 500 inspections of licensed care facilities, and 5,400 inspections of food service operations. Our public health nurses provide nearly 6,000 perinatal home care visits and 30,000 childhood immunization appointments. From birth to end of life, Island Health strives to provide excellent health and care for everyone, everywhere, every time.
I have to say, whenever I see that video, it's like, wow, we have a lot of people providing a lot of services, and thank you to all of them for caring about our patients and clients. So I'm Leah Hollins, the chair of the board of Island Health, and on behalf of my colleagues, welcome to our public forum, whether you're joining us here in person in the Comox Valley Curling Center or online through our live stream. I respectfully acknowledge that the land we gather on is the unceded traditional territory of the Comox First Nation, the traditional keepers of this land. And I'm so glad now to introduce Donna Mitchell from the Comox First Nation to start our meeting with a welcoming message. Thank you so much for coming, Donna. I've been admiring Donna ever since she got here because she's got such great things on.
Yo, Kayla Kessler, good to see you all here. Welcome to the unceded traditional territories of the Comox First Nation. I am Donna Mitchell. I come from a long line of hereditary chiefs. My mother was from Stenamo, my father Comox here. I've always said Qualicum because that's where my grandmother came from. And I worked in nursing. I graduated in 1972 for an LPN course. And I worked at the Ford Hospital, Laurel Lodge, and Cumberland Health Center. I stayed there 31 years, but it was 39 years that I stayed in nursing. And now I'll take you back to 1957. I had a sister, Bernadine, and I don't know, you guys all must know that it was run by priests and nuns back in the day. And my sister was a week old, and we'd go and visit her every time my father got off work. And she was a crib death, and the priest put the baby in an incinerator. And this is a good place to tell, because I've brought my sister. I got this made this year. My cousin made it this year. And I said, this is the 5th time I've taken my sister around with me. I take her all the time with me. But in that time, I've made quite a few friends of mine who I call my sister, but they're really not. And today, I hope everyone learns a lot from these ladies and their speakers and everything. But when I worked in Cumberland, May Day this year, they asked me to come do the blessing up there, and I looked out in the crowd and I can see the cook, I can see the housekeeper, I can see the RN. I said, this is like coming home, you know? I walked in there and I was 29. And I'm 72 now, and it's like, wow, you know, to see everybody again. And not too many places that you can go to and feel like you've made a difference and you're coming home, you know? Like, work, and I say that to our band office. It's not, how would I put it? It's not consistent enough. When they get in, they're only chief and council for 2 years. You can't accomplish anything in 2 years. It takes many years to get anything accomplished in life, you know, as far as I'm concerned. I like going in there to help people all the time. I volunteered at our health center for 18 years. And in that, then we had COVID, so I had to quit going there. So my girlfriend gave me this shawl I've got on, and I say, oh, I know what I'm gonna do with it. So I did that throughout COVID. And I said, now I think I need a new cape, because I don't think COVID's ever gonna be over. So everybody be careful, be safe, and keep your distance. Gaila Kessa.
Thank you so much, Donna. We really appreciate you being here. And I raise my hands in gratitude to you for welcoming us to work, live, and care within your traditional unceded territory.
That's right.
It's very much appreciated that you can. Thank you. Okay, great. Yeah, that would be lovely. In addition to the acknowledgement that I've already done, I want to acknowledge the Inuit and the Way From Home urban Indigenous people, as well as the Métis chartered community. We do this to reaffirm our commitment and responsibility to improving relationships between nations and to cultivating our own understanding of Indigenous peoples and cultures. Please join me in reflecting on the harms done, such as the cultural genocide and assimilations of Indigenous people, the residential school system, and discovery of graves of Indigenous children who attended them, the too many missing and murdered Indigenous women and children, and the social inequalities and racism which exist today. I invite you to think about the responsibility we each have to act in the spirit of reconciliation, healing, and collaboration. As a healthcare organization, Island Health is committed to cultural safety and humility, and we demonstrate this through our actions to address Indigenous-specific racism, systemic racism, and the ongoing impacts of colonialization. Public forums like this allow the board to meet the people and communities we serve and are essential to our commitment to transparency and accessibility. Our time together will help us better see what matters most to you, so we can increase our understanding and refine our thinking. As a governance board, we are responsible for the overall direction of Island Health. The Minister of Health appoints the board, but we each choose to sit on the board because we deeply care about health and care. As a former nurse, Deputy Minister of Health, and Chair of Canadian Blood Services, the patient has always been central to my work. I always ask myself, is what I am doing right for the patient? Because caring for the patient is why I started working in healthcare and why I continue to support the delivery of health and care. I might want to be on the right page, though. What do you think about that? Caring is why every member of the Island Health family is dedicated to delivering Island Health's vision of providing excellent health and care for everyone, everywhere, every time. It's now my pleasure to introduce you to our directors who are responsible for the overall direction of Island Health. The board consists of 9 directors, in addition to myself, and I'm going to introduce the people who are with me at the front here first, and then I'll talk about the 5 people who aren't here, aren't able to be with us. Ann Davis is here from the Comox Valley. Shawnee Cassavant from Hupatchesett and Sechot First Nations on the West Coast, and Diane Brennan from Nanaimo. We have 5 members, as I said, that weren't able to be here today for a variety of reasons. Ron Matson from View Royal, Andy Adams, who's our newest board member, and some of you will know from Campbell River, Alana Nast from Victoria, Ann McFarlane from Victoria, and Ron Rice, a member of the Cowichan tribes who lives in Victoria. We also have our local leadership and executive management team members joining us. So I'd like you to wave so people can see who you are. Great, thank you so much. You will hear from some of them later this afternoon. We have quite a full program today. Dr. Charmaine Enns, our medical health officer, will share an update on public health and wellness in the region. We will have a presentation from Providence Health and Providence Living on the new dementia village under construction in Comox. And the last part of the agenda will be an opportunity for you, community members, who have come to our meeting or submitted questions in advance. I will open the floor to questions so the board can hear from you. But first of all, I want to introduce Island Health's President and CEO, Kathy MacNeil, who will begin by providing an update on the delivery of health and care services across Vancouver Island and here in the Comox Valley.
Thank you, Leah. Good afternoon, everyone. It's great to see people here with us today. And I would like to also thank Donna for your wonderful welcome to the region and to the territory here this afternoon. I'd like to thank and acknowledge the Comox First Nation for the stewardship of these lands, for traditional keepers for time immemorial. I also want to recognize the Inuit First Nations from other regions and Métis Charter community who call this area of Comox Valley home. We've recently marked National Truth and Reconciliation Day over the weekend, and recent findings on the Stolo lands in Fraser Valley remind us that the trauma and pain of residential schools remains today as much as it has been something in the past, today families continue to grieve what was brutally taken from them. And Donna reminds us as well, hospitals were part of that story as well. So that's why our work at Island Health is so important, to make sure that healthcare is safe for people who have been traumatized by healthcare in the past. I'm grateful to be here today in person. It's so nice to be in person. And also for those of you who've joined us virtually online, thank you for coming and taking some time to be with us today to talk about health and care. Some of you were able to join us this morning where we had a breakfast with our community partners. And we had quite a good discussion, engaging discussion, focused on how we can collaborate to integrate health services in the community to support the residents here in Comox Valley. And we also discussed the value of community partnerships and collaboration, and how everyone has come together here in this region to tackle the health inequities in outcomes, in experience, and particularly in access. I'd like to thank the partners who were able to attend this morning, and also for their very valuable work here in the Comox Valley. More than a quarter of the population here in the Comox Valley region are seniors. The proportion of the population over the age of 65 is higher in this region than in other parts of the island. And since 2017, the BC government has committed to supporting seniors and investing in long-term care across the island. In other parts of Vancouver Island, we're excited and grateful for the recently announced 300-bed long-term care home in Colwood and the 153-bed long-term care home in Campbell River. And here in Comox Valley, the 120-bed Oceanfront Village opened in Courtenay last year. We're going to hear about the construction of the state-of-the-art Dementia Village operated by Providence Living, which will be on the former St. Joe's site in Comox. And we're really excited about the opening. I know that the team of Providence Living is as well, projected for July of 2024, and Sharon's nodding, so that's a good sign that they're on time and on track. This facility will foster a sense of community by creating a home-like and safe environment for those with dementia. And it's based on a popular care model used in Holland. I think we heard today it's from Holland. I look forward to hearing more about the planning and modeling of the Dementia Village during Sharon's presentation in a few moments. We just came here to the Curling Center from the Cumberland Laundry Services, and we met hardworking folks who run that laundry facility for this region. I'm not sure everybody knew that there's a building nestled in that little town of Cumberland that provides laundry services to long-term care facilities across Nanaimo, Port Alberni, Comox Valley, Campbell River, and to all of our hospitals in those communities as well. It was originally built to support 3 hospitals, St. Joseph's, Cumberland Lodge, and Nanaimo Regional General Hospital. And since it was built, it's doubled in size and in processing. It's now processing more than 7 million pounds of laundry each year and serving over a dozen healthcare facilities. And I have to say, I actually felt lifted up leaving that laundry facility, thinking about how much fun people were having there, how happy they were doing the work. Who could be happy doing laundry? But they were really happy doing the work of making sure that we had enough laundry for all of the facilities here in this region. Just really grateful to them for the work that they do, and they're quite inspiring to the rest of us. Also this morning, we had a chance to visit the hospital here in Comox Valley, where we saw the teams are working hard to make sure that safe care is delivered every day. Hospitals are a vital component of the healthcare system, and like all other parts of the system, our hospitals are under considerable strain. And I know that the North Island Hospital staff and physicians in the Comox Valley work tirelessly to care for the people here. I want to thank Frank DeWard, who toured us today, the site director of the North Island Hospital, Comox Valley. Frank told us of the great work that's happening there to reduce hospital occupancy. And I can recall not that long ago, when this hospital was first opened, it was full to the brim right from day one. And Frank and his team have worked hard to make sure that we've turned down that heat and our occupancy is much closer to the bed base that's there so that we can provide safer care. But the way he's done that is not necessarily changing things inside the building. It's working with the people outside the building. And that is the solution, to work as a system with all of the community services that support our patients. So I want to thank Frank for your leadership. Also want to thank Dr. Ron Collins and Dr. Sarah Scott, who are medical leaders at the hospital as well. We know there's a point of pride from the team here in Comox Valley, and it is the ability that the team has shown to step up to the challenges of increasing the surgical volumes. Surgery is an area of focus for us since before the pandemic. And when we went into dealing with the pandemic, wait times for surgery were significantly impacted. So we had started some work, and we had to put it on pause because we were dealing with the pandemic, and so those wait time gains we had pressed pause. However, since then, since we've come back to normal operations, significant actions have been taken to fully recover from the reductions that we saw during that pandemic period. I'm pleased to share that this year alone, the surgical team at Comox Valley Hospital has already completed approximately 3,475 surgeries, which is more than the number of surgeries completed last year. It was 3,400. These surgeries are instrumental in reducing wait times for patients. And given all the pressures, that's a huge accomplishment for the team, and I'd like to thank that hardworking team for making it happen. Island Health and the First Nations Health Authority are working together with Comox First Nation and the community to select an elder in residence role for the North Island Hospital here at Comox Valley. I'd like to acknowledge the late Elder Frances Prince's contributions to supporting culturally safe services for the community, as she was our very first elder in residence here on Vancouver Island. Frances was a tremendous support for Indigenous patients, their families, and for the healthcare team. And Frances is greatly missed. So we look forward to having that role filled so that we can support, again, culturally safe care for people who are accessing services at Comox Valley Hospital. As I mentioned earlier, some of the solutions to occupancy of hospitals actually happen in the community. Being able to support people at home aligns with what people want as their care needs increase. It enables the resources in hospitals to be available to those who must have hospital care. Comox Valley Home Support Services has supported 659 clients this year. It's an increase of 10% of the number of people who've been receiving home care services. And I know there's been lots of work done by the team to implement additional services to support people living with chronic conditions to stay well at home, including respiratory therapy in the community, and they help clients cope with COPD and other respiratory ailments. And they also reduce the outpatient testing wait time for spirometry. Also implementing diabetes and insulin management in the community to help support clients manage their illness and prevent further complications. An innovative initiative that has started here on Vancouver Island is what we call the STEPS program, Short-Term Enablement Suites. And we have 4 of them here in Comox Valley at the Washington Inn to support people requiring transitional care to return to the community. STEPS is an innovative program that allows people to access enhanced healthcare services in the community, and it provides the staffing, furnishings, and equipment for patients who might be ready to leave the hospital but may not be quite ready to return home. They're able to receive enhanced rehabilitation and community supports for up to 90 days to enable a better transition home from a more appropriate care setting than a hospital room. A strong and healthy primary care system is fundamental to effective hospitals and care in the community. For many years, primary care meant going to a physician's office for most people. Today, British Columbia is taking a new approach, a partner-driven approach to primary care. Physicians continue to lead this work, and they're part of a larger primary care network. Island Health is fortunate to participate as a partner with local physicians at the Division of Family Practice, the Comox First Nation, and other partners in the Comox Valley Primary Care Network. There's more work to be done to ensure people have a primary care provider. However, good progress is being made here in this community. With support from the Primary Care Network, the Beaufort Family Health opened the Cumberland Village Healthcare Center on September 1st. The Family Health Clinic features 6 family physicians and nurse practitioners who deliver inclusive and comprehensive patient care. As of May of 2023, over 10,000 patients have been attached to a primary care provider here in the Valley. Of those, nearly 7,000 were attached through the Health Connect registry since its launch in April of 2021. It's an incredible number. There are 3,278 patients waiting to be attached, and the Primary Care Network is committed to reducing the number of people waiting on the wait list. So for anyone who's looking for a primary care provider, make sure your name's on the Health Connect registry. The providers here in the Comox Valley are working very hard to pull all those patients who are waiting from that list, and they're doing a great job. I'd like to thank the Division of Family Practice for their hard work and leadership in recruiting physicians to this area. The division's work has been invaluable in bolstering primary care support in the Comox Valley. And we are advancing 2 key primary care clinics locally with our partners. Earlier this year, Island Health took over the operation of the After Hours Urgent Care Clinic, serving nearly 1,300 patients so far, and will expand this service later this fall. Another critical primary care provider is the Comox Valley Nursing Center, a team-based primary health care facility providing care for eligible Comox Valley residents. The nursing center team consists of nurse practitioners, family practitioners, registered nurses, social workers, medical office administrators who pride themselves on delivering trauma-informed care, harm reduction, and their evolving response to the unregulated drug poisoning emergency. We know much more work is needed to increase primary care access here in Comox Valley. Through the Primary Care Network, we'll be continuing to invest in additional community services over the coming months and years. Like every community, Comox Valley is impacted by poverty, marginalization, homelessness, mental health, and substance use. As is the case in communities across Island Health, people who are experiencing these challenges are our neighbors, our friends and family members, and collectively, all partners need to do as much as we can to support them in their home communities. In the area of substance use, we've expanded outreach teams and services. These dedicated mental health and substance use team members work all over the community to see and support people where they are, in supportive housing sites, social support agencies, and in encampments. For youth, we've added 5 treatment and supportive recovery beds in the Comox Valley. We're a key partner with the Ministry of Children and Family Development and the school district in the Comox Valley, the Integrated Child Youth Team, and a funder and partner with the Comox Valley Foundry, which provides access to mental health and substance use supports, primary care, peer supports, and social services for young people between the ages of 12 and 24. Through the Comox Valley Mental Health and Substance Use Intake Office, people can access the full range of mental health and substance use services, including screening and assessment, and connection with services such as counseling, psychiatry, community-based substance use programs, intensive case management, short-term assessment and treatment, one-to-one therapy, group therapy, information about other community resources and support groups. We are actively working across Comox Valley and Campbell River to find a suitable location to establish a detox service, which will be accessible to residents without having them need to wait to go to detox in Nanaimo. In the past 6 months, we have significantly increased access to bed-based addiction treatment services, including adding 40 new publicly funded treatment beds, 30 beds across 3 treatment sites in Victoria, Cobble Hill, and Nanaimo, and 10 Indigenous-led beds in Port Alberni. These beds are accessible to all Vancouver Island residents, including Comox Valley residents. The services provide more extended term treatment with stays of up to 90 days. As part of the approach to harm reduction, we recognize the need to stay current in offering overdose prevention services that include inhalation or smoking as a means to consume substances. We are working internally with our partners, particularly the town of Courtenay, to provide an inhalation overdose prevention service in the Comox Valley. This work is high priority and ongoing, and we hope to see a new service up and running in the coming months.
If it keeps growing at the rate that it's been growing, we'll be up closer to 97,000 by 2041. And I've included just a breakdown of the age categories so you can see that proportionately the number of people 0 to 19 all the way to 90 plus. And proportionately, most of the growth, when you look at it in terms of rates, will be seen in the 75 plus, and that's because we have long life and high life expectancy. Thank you for being here, Donna. The average age is 47 years, which is a year and a half older than it was from the last census data. Next slide, please. So, we can do all kinds of razzle-dazzle with numbers and statistics, but really health is defined by communities, and communities in taking charge of their health and wellness. So I want to give some examples. These are not my examples. I asked a question of what are some things you're doing that you're proud of that's improving health and wellness, and these are the examples I got back. And I think they speak really loudly to the things that I would have asked for if I could have actually picked them. So I just want to mention the City of Courtenay. They submitted an application for peer-assisted care team funding, and they're one of the 3 cities that received funding back in July, and this is to create a team that is comprised of both a mental health worker and a trained peer to respond to people in crisis. And I see Councillor Hillier here, who is very instrumental in that submission and the success of Courtenay, and I'm just terribly proud of the work that was done to provide care and support to folks within the City of Courtenay, but the Comox Valley as a whole, who are struggling with challenges as it relates to substance use and other crises. And the benefit of the pact is that the police aren't called. So there's so many important benefits to this work. Town of Comox has entered into a beautiful example of engagement with youth, asking youth, what can we do to help you enjoy the outdoor and be outdoors more? And through that engagement and feedback, they're acting on the recommendations from the kids, which go all the way from being an adrenaline junkie to just hanging out with my friends. And they're well on the way to responding to the youth, and through that, obviously, that demonstrates the value of youth and what that means in their community. Next slide, please. And the last example is from the Comox Valley Regional District on the Comox Valley Emergency Program. The coordinators of the Comox Valley Emergency Program, to me, could provide a master class, and I'm always feeling like I'm in a master class with them on how to build partnerships and how to collaborate across jurisdictions. They have, through their facilitation and through co-development across a wide diversity of partners, have, just one example is ensuring that there's warming and cooling services in our urban and rural centers. As climate change becomes more and more a normal thing in terms of the range of what happens, the ability to be able to be adaptive. They're working very hard at that through partnership, and also through partnership to identify and co-develop who needs training for what, and that we're all trained in it together so that there's a response that's coordinated. So this demonstrates the ability to adapt, to be prepared, and that ultimately builds community resiliency. So next slide, we're going to talk just really briefly, because of time, I just picked a few determinants, but I want to spend 1 minute on this slide. Why determinants? Why do we talk about determinants of health? The healthcare system is important and necessary, but it actually doesn't contribute that much to our health and wellness. Sorry. It's like 20% on a good day. So 80 to 90% of our health and wellness is coming from other places and other ways. And those factors are determined through very important and key things that we all recognize, but we might not recognize how important they are. So, for example, where you live, what house you live in. Do you have a house to live in? Are you experiencing racism, discrimination, your education, your job opportunities? What's your income? Do you have access to do you have access to affordable, nutritious food, physical activity? What's your air like? What's your water like? And I want to especially emphasize early childhood as a significant key determinant of health. And why is this important? Because what happens in those first 5 years sets the trajectory for the rest of your life. And so we know from birth cohorts that early life factors that are compromising determinants or challenging determinants, even though physiologically it might not make sense to us, but they contribute to much higher rates of heart disease, to type 2 diabetes, obesity, memory loss, serious mental health challenges. We also know from studies of preschool children in the US and in Canada that the circumstances of the family early in a child's life, so that means, is there money in the home for things? Is the family educated? Is it a single parent home? What's the parenting style? The neighborhood that kids grow up in, is it safe? Is there social cohesion? Is there socioeconomic diversity? And social institutions like daycare. Those are powerful determinants of cognitive and behavioral development. So the determinants of health set the path for what's ahead. I can't emphasize how important it is we focus on our kids and our young families. Next slide, please. So here's one determinant, is housing. You can see the Comox Valley is where the red line is going up and down. It's 30, this was back in 2021. So at 2021 in the census data, 38% of households were spending 30% or more of its income on shelter costs. Why is that important? 30% is a threshold that we use as a measure of affordability. So if you're spending more than 30%, you don't have money for other important determinants. And we know what housing has done even since 2021. Next slide, please. So the unemployment rate, I need to point out, this is from the pandemic. This is not current. So the unemployment rate in the Comox Valley at the census in 2021 was 8%. Right now in BC, as of the end of August, the unemployment rate in British Columbia is 5.2%, and on Vancouver Island is 4.9%. So we really suffered during the pandemic with unemployment, and unemployment is an important determinant. Cost of living. The cost of living, this is a study that the BC CDC puts out, just came out last year, looking at the average cost for a family of 4 with what we call a healthy food basket. And you can see that for the North Island, I don't have it specifically for the Comox Valley, but over $1,300 a month for a family of 4, higher than the BC average. What's important about this, though, is that this statistic or this number does not actually account for the disproportionate distribution of the costs within the population. So single-parent families, people living with disability, low-income families, they pay proportionately way more than the average house. And rural and remote households, of course, are also not represented here. Why is this important? Food insecurity contributes again to lots and lots of food problems. So increasing chronic disease, increasing infectious diseases, increasing mental health challenges, lowering life expectancy. Next slide. Lone parent families, I just want to show this again because it's an indicator of what it means for kids and for families. Why do kids matter? Kids are our future. Kids are going to be looking after us. Kids are our leaders, right? We were all kids. So I'm thankful that even though it's small, the bars might look more than they actually are, but there has been a tiny drop in lone parent families in the Comox Valley since the last census. So in 2021, it's at 13.9%. Next slide. I've got 1 minute. Yeesh. Okay, so indicators of health and well-being. Next slide, please. The toxic drug, people are dying of being poisoned. So under the age of 59, drug poisoning is in the top 2 leading causes of death for all people under the age of 59. And most importantly, in the 19 to 39-year-olds, it's the #1 cause of death. And not only the #1 cause of death, it is over half of the deaths in that age category. There's lots of work to be done, continuing to be done and is being done. Next slide. It's not just illegal substances that are a problem, it's our legal substances. Oh, this just shows, sorry, I was all gung-ho on alcohol. Okay, this here is just to show that where the blue line is the Comox Valley, the rate of death due to toxic drug crisis. We're starting to see a drop in 2023, so lots of gratitude for that, but it's still big distance yet to go. Next slide, please. In the interest of time, alcohol is something we must pay attention to from my perspective as a public health physician. The first slide shows the consumption rate in the Comox Valley compared to Vancouver Island. On average, in the Comox Valley, for everybody age 15 and over, the average alcohol in 2022, the consumption was 674 standard drinks, which is 13 drinks a week, which is almost 2 drinks per day. The new Canadian guidance on alcohol and health says that if you're drinking more than 7 drinks a week, you're in the high-risk category for cancer and heart disease. So the hospitalizations, the black line for hospitalizations and deaths is directly related to alcohol in the Comox Valley, and the brown line is directly related to opioids. Big difference. And we don't want to talk about alcohol. I'll come back and talk about alcohol happily. Okay, next slide. Mental health and well-being. This is just to show that the bars that are lined up are the Comox Valley, just to show the impact that during the pandemic, the impact of the pandemic on our mental health and well-being, and more people, like half of the population surveyed, felt that their mental health worsened, that they're far more stressed, and that they feel more disconnected, and they don't have community. Next slide. I'm on my last one. Next slide. And I'm going to finish off with kids again, because this here is the early years development index, and what this shows is this is like basically a census on the population of kids in terms of their readiness to start school. So preschool, this is before they start grade 1. And it looks across 5 important domains of development before you start school. Your physical health, your social well-being, language, cognition, communication, and emotional maturity. And based on that assessment, kids that are vulnerable on one or more of those domains will need or should have extra support or care to be successful to get through school, which will also make a difference in getting through other things in life. So in the Comox Valley, in the last wave of the EDI, 37% of kids starting school were vulnerable in one or more domains. The importance about looking at information over time is also important. So that sounds like a lot, but I want to just also take a positive perspective that we've made progress over the last few waves of assessment. And I know there's been a significant amount of work from very passionate people to improve the vulnerability of kids as they come into the school years. So the blue is the Comox Valley and the black is for Vancouver Island, just to show. And I could explain more of that later if I had more fancy graphs, but I don't. So thank you.
Charmaine points out many, many, many important items about health and wellness that we don't always pay much attention to, because most of us think that hospitals are really sexy and they need all the money and all the attention. And really what Charmaine's talking about is incredibly important to our health in the short and the long run. So thank you, Charmaine, for that. Now we're going to move to a presentation on the Dementia Village. And just one note, our board may have questions for the presenters, which they will ask immediately after the presentation. So if you, the public, have questions, there will be a Q&A portion at the end, and we kindly ask you to save your questions until then. Our presenter is Sharon Parks, Executive Director for Seniors Operations with Providence Healthcare and Providence Living. Welcome, Sharon.
Thank you, Leah, and thank you, Island Health, for allowing me the privilege to present our new dementia-friendly village called Providence Living at the Views, which is on the old St. Joe's site on Comox Avenue. Next slide, please. We can just move on. I'll just go straight to the, I don't want to be rushed, like, I've got to keep it real. So just some of the basics. This is a publicly funded adventure. It's 156 beds. We're excited to announce that these are based around 13 households, and each household has 12 bedrooms with an ensuite. This is different from the current setup that we have at the Views, which is mainly multi-bedrooms, so 4 or 2 bedrooms, very few single private rooms. So this is an amazing advantage for the residents that are currently at the Views that will be moving into this new building. We are on track and on budget for occupancy in July 2024, and as I said, it's on Comox Avenue. It's based on the 14 acres of land that we have at the St. Joe's site. So great views if you've ever been there. I know I'm looking at some of you have. It's amazing views of the ocean. Big thank you to the partners that are up there, from the Ministry of Health to Island Health, to the foundations that are helping us, and many, many more people that are helping us. Next slide. So one of the main features of this new building is the courtyard. And what we're hoping to achieve here is freedom of movement for our residents. Long-term care, historically, people are locked up in locked units for their safety. And so for us, one of our dreams is to enable people to move freely within the building, the confines of the building, so within the household that they live in and within the courtyard that you see here. The courtyard has many features here, from multiple trees and areas that the residents and families can walk around, to a childcare area where residents and families can bring their children, so that for intergenerational play. A veranda there, and a paved courtyard which backs into the bistro, which will be accessible for families and residents to come and have a cup of coffee. And we're applying for an alcohol license, so sorry, Charmaine, but with a little bit of alcohol will be available, and a barbecue area, as well as a landscaped area for some of our horticultural activities that we have. Our big things in the courtyard is our chapel, which is it's Catholic, but it's non-denominational. It'll be open to all faiths. But the other one is working closely with our Comox First Nation and our sacred space. It's called the Big House, and we're hoping that we will soon have an official name for that, given to us by the Comox First Nation. Next slide. The building is 3 stories. is 3 stories. I'm just going to walk you through quickly through this. So this is the ground floor. Some of the special features that we have there is a central laundry. So we're doing all our own laundry there. A commercial kitchen, which will help us deliver some of the meals, but not all of the meals, and I'll go into a little bit more detail. We also have our adult day program on this floor and our daycare, which will be opening with 35 new spots for the Comox Valley. Next slide. This is the main floor, and if you look at the areas where it's sort of numbered 2, 3, 4, 5, 6, 7, 8, 9, this is our main community area, and this is the piece that is based on the De Hoogway model in Holland. So what we have there is a community center where some of our larger activities can be held, whether that's bingo or movies, those different types of events for our residents, but there also is a convenience store where residents will be able to come down and buy groceries that they can then take back to their households to cook mainly around breakfast and lunch, so they'll be able to buy some of those supplies there. We also have our art center there, our wellness center, where residents will be able to visit our on-site OT and physio and rehab assistant to do exercises. And we also have our medical clinic there, which we're still trying to work out what that would look like, but we do know that, for example, our dentistry services would be provided in there rather than be provided in the residence room. Next slide. The second floor is, the first floor and the second floor houses all the households, but what each of the households do have, as I mentioned, is the 12 private resident rooms with ensuite bathrooms, open concept living and dining rooms with a laundry area as well for in-house laundry that can be done with our residents and our staff. Each 2 rooms do share a spa, which is where the house, they share a spa, which is where the bathtub will be. We also have 6 rooms that will enable couples to share. So there's a room between 2. There's a door between 2 rooms, enabling them to share, and we have 4 bariatric spaces, so to be able to help with that clientele as well, with the needs and the space that they require. Next slide. These are some of the renderings that we have, and so I'm going to point you to the one that says resident household kitchen and dining. So this is pretty special. What we have here is an actual full kitchen that we'll be able to cook with our residents, and the meals that we're planning on cooking there are breakfast and lunch, and then the evening meal will come up from the kitchen. So as you can imagine, when you're at home, one of the things that makes you feel at home is the smell of food being cooked, being able to prepare food. And so this is a big focus about being part of a family and being part of a community is meal prep. There also is the dining room there. We're changing that a little bit, so rather than at the moment we have very separated tables for our residents. Feedback from the De Hoogway model is that to create that family-style cooking is to have one big table. So we're calling it our harvest table, where residents have the ability to sit with other residents, discuss their day, and talk about the events that have happened to them, a bit like when you're at home with your family. And the other thing we don't have in that area is a traditional nurse's station. We've made a conscious effort that we don't want that. We don't want this to feel institutional. We want this to feel like someone's home. And in your home, you don't have a big nurse's station with glass barriers and folders and things. So we're trying to make it very, very non-institutional. The other pictures there are our main entrance when you walk in, and then our chapel. Next slide, please. We're back to the exterior. So I talked about the horticultural services that we want to provide. And so we actually already had these raised flower beds that are already put in and garden beds to enable our residents to participate in growing some of their own vegetables that they then would be able to pick and take back to their home and prepare. And there you will also see the pointed building is the chapel, and the one to the left is the big house, which we are working very closely with the Comox First Nations to try and ensure that it meets the requirements of what for a culturally safe environment for our current residents who have an Indigenous background, but also for future residents. And I think the next one you've seen, it's pretty much the exterior. So we can go on to the next slide. Some of the innovation that we have in the building is around logistics. And so this is a big building. It's around an acre. in size. And so we started thinking about how we would move some of the supplies around. And so I went on a visit to San Francisco, and one of the hospitals there, they have automated tugs. So it's a little robot that pulls all the supplies around. And so we have invested in purchasing 4 of these robots that will pull the supplies, so linen, medical supplies, and the food to and from, which will enable us hopefully to move some of the staff that work in that area now to be actually more focused working with our residents. Tunable lighting. We've invested money to ensure that our lighting aligns with circadian rhythms, and so it's very cool that as the day progresses during the day, you have very different sunlight in the morning than you do in the evening, and so this lighting is able to do that, to mimic what it's like to be outside, to hopefully help us reduce some of the sundowning that some of our residents experience later on in the evening. As I mentioned, we're really adamant that people will have freedom of movement, and what does that look like? So the one way that we have been able to do that at the moment is with real-time locating system. And so this is a system that will allow a resident, if they are carrying a fob or a key or a watch or a lanyard, to be able to pass through doors safely. And for us as the staff to know where they are through on an app, we'd be able to pull up a map to be able to see where they are, so we know where they are within the facility. Staff communication, we're looking at one smart device, which will enable the staff to just carry one piece of equipment, again, to be able to see the CTV cameras, to be able to communicate with each other, and to find out where our residents are. Next slide. So what I've just showed you is the building, and the building is just, I was going to say bricks and mortar, but it's not. That's quite English. It's wood, and some steel frames. And so what really matters is how we implement what we call our new model of care, which is our Home for Us model of care. And so we've spent a lot of time working with De Hoogway in Holland to develop a similar model to they have, where we've looked at this philosophy in 3 dimensions of care. So one is looking at emotional connections matter the most, where residents can direct each moment, and looking at where home is not a place, it's a feeling. And so we want this to feel like people want to be there as much as they can be, and that it feels like home to them. So some of the things that this is enabling us to do is for residents to live their lives with freedom, choice, and dignity. Supporting our teams to feel empowered to make decisions, taking cues from residents rather than working to schedules and tasks that they currently do. What we have done at the moment is we've set up 2 pilot units at the Views. On one of our units, we've created 2 10-bed units, which is helping us test some of these theories. And that officially has been going on for about 3 months, but we officially split the sides, so now there is 2 10-bed units. That happened 2 weeks ago. So that's exciting for us to be able to work out how we're going to run through this model of care. And then the next slide. I think this is a bit fancy. You might want to just keep pressing. There you go. Yeah, so I think it's just to emphasize that we're not wanting to take away from the high quality medical care that these residents need. A lot of these residents do come with specialty medical needs and care. But what it is trying to do is promote the best day, a day well lived, and also ensuring that our staff look at going to work more as if they're going to work in a resident's home rather than they're going to work in a facility. Next slide. Okay, thank you. I made it. I made it. All right.
Thank you. Thank you, Sharon. That is really exciting, and we're thrilled to be in partnership with you as we move forward. So we will look forward to more about this, and certainly if you've been a resident in a long-term care facility, this is going to be pretty fantastic. So thank you. I just want to ask my board colleagues if they have any questions for Sharon. Go ahead, Diane. There's a mic there, Diane, if you want to use it. Thanks.
Thanks. I was interested in your decision to keep the laundry in-house, given our run-through at the laundry facility here, I just wondered what were the components of making that decision, and that's my question, really.
That's a really great question, because when I was listening to the amazing work that they're doing in Cumberland, I think some of it is around us being able to provide a different type of material and laundry for these residents. We really wanted to move away from some of the facility laundry that we experience and to have something that's much more home-like. This way we can control it and we can make sure that it's being cared for in a slightly different way. And then the other pieces that one of the experiences that we wanted residents to have, and not all residents will want this, but part of being at home is that you do your laundry. And so we wanted to be able to bring some of that back into the household. And so residents with staff can do that. I hope that answers your question.
It does, actually, yes. I think my mom would have liked that. Yeah. She even ironed our underpants, so, yeah.
I think so. Any other questions? Well, thank you for coming today and for the great work you're doing in the community. It's much appreciated by us, and I know that it's much appreciated by a lot of people you aren't going to hear from. So now I'd like to open the floor to your questions to the Island Health Board. Please keep your questions brief, 1 to 2 minutes, to allow us to answer as many as we can before we adjourn at 5 o'clock. We've also received some questions from the community via email, and I'll ask these questions in between your questions here in the room. So any questions from inside the room? Let me get you a mic so you can be heard.
Okay. The first one, I just happened to notice when you were listing them all up, how come there are no members north of Campbell River? Because we have Port Hardy and Port MacNeil, and they're always being shut down because there isn't people up there and so on and so forth. So I'm wondering why there isn't a representative on the board north of Campbell River. Okay.
Right. Yeah, okay. Go ahead.
Well, I've got lots of hearsay things, but I'm not interested in that. What I am interested in is the support for mental health. Lots of talk, lots of people getting paid to sit behind desks and come out and give you a phone call, and the only question they're really interested in, are you going to hurt yourself? And after that, it all fades away. I've been waiting over a year to get some help in psychiatry and stuff like that. The doctor took 6 months to get to somebody who would even phone me, and then a psychiatric nurse comes in that, but the rest of it all disappears again. As soon as they know you're not going to hurt yourself, yeah, well, we'll put you on the list and we'll maybe get to talk to you or something like that. So the support for mental health, because I don't know if they are, normal people are making judgments. They don't know how a mind works and what goes on with it. And just because you can function every day doesn't mean that you're okay. So there's an area to be worked on there.
Okay, thank you.
I can't even read my own writing anymore because my hand hurts. Anyway, well, that's the mental health thing was the thing I was most interested in. And I liked what the lady said about determinative health. Our government, Department of Health, nobody thinks about being proactive. I mean, everything from industrial food doing who knows what to people, because I know the difference between what I used to eat when I was a kid and what I see people eating now. And one thing in particular was good old Mr. Campbell, to save himself money, canceled annual eye exams. Eye exams tell you a lot about a person's health beyond whether they can see, and that should be back. And if you have to go and fight with the budget people, that should be back. Especially the older you get, the more you can learn and be proactive about instead of always reactive. And then there's also doctors. The Ministry of Health has forced doctors into a business model where, yes, make an appointment, maybe 2 or 3 weeks down the road, now you get 15 minutes and we'll tell you your problem. So therefore, everybody has to head either to a clinic or to the emergency room if something actually happens. That's, okay, those are the things I can think of that somebody needs to think about, and I don't know that you can give me answers to them now. It's whether you'll fight for them.
Okay, thank you very much. I will read one of the pre-submitted questions now, while we see if there are other questions from the floor. Why is BC only offering Fluzone high-dose to seniors who reside in long-term care or assisted living facilities and in First Nations communities, and not to the rest of the seniors community. So Charmaine, I understand you're going to answer that. Thank you.
Can I just stay here?
Yeah.
Yeah. So good question. So first off, I just want to say Fluzone high dose and Fluad are the same, give the same response. So they're different. They're slightly different in that. Don't want to get into the technicalities of the vaccine, but the effectiveness is the same. Both vaccines are recommended for seniors over 65 to give an enhanced response, enhanced immune response against influenza, and the price is also comparable. But what happened in the pandemic, because provinces make decisions based on what they publicly fund, and there's slight differences from one province to another in publicly funded vaccine, and in the pandemic, the federal government provided Fluzone high dose for all long-term care facilities throughout the country to ensure consistency of availability to Fluzone high dose during the pandemic. So they've been doing that. This is the last year the feds are going to be providing that. In BC, we expanded that to include people over 65 living in Indigenous communities. And then we bought Fluad for all other seniors over 65. So there is no difference in, again, the effectiveness of the vaccine. It's just what's available and how we got it. And I just want to provide that reassurance that if you're over 65 and you're getting either of those products, you are getting excellent protection.
Great. Thanks so much, Charmaine. Other questions from the audience? Go ahead.
Thanks. You praised the nursing center here, and I know that I think in the late 90s, there was a move to shift a lot more of the hospital-based healthcare to community-based healthcare. And there's been sporadic initiatives that way, but it doesn't seem to be in a major way. I'm just wondering, why is that? Is it costs or staffing or what? And is the provincial government looking at that more seriously?
Thanks, Kathy.
Can you hear me now?
Yes.
I thank you for the question. And in fact, we were asked earlier today, what does Island Health mean by the word sustainable? Sustainable healthcare. And in fact, that's exactly what we mean, is moving as much healthcare service delivery that we can into communities that doesn't need high resource technology capital or a specialized expertise or training. Here in the Comox Valley, it's my understanding that the home support, community health services has grown, I think it's something like 8% over the past year. Have I got those numbers right? Really close? Good. And the government is investing in community health services as a strategy because, first of all, as Dr. Enns showed, as the population continues to grow at the aged end, we don't have enough long-term care. We will never have enough long-term care. Even when we build new beds, we won't have enough long-term care facilities. So we have to figure out another way to enable people to age safely at home, and that's an enhanced community health program. So that is exactly what what government has in place. The other piece of work that they've done or have asked us to do, and we're well on the road of doing that, is integrating programs in the community so it's easier to navigate. Because we can put lots of resources in the community, but if the public don't know how to access them, or if there's multiple doors or multiple forms, or we've just put too many barriers in place, there's no point in putting all those resources there. So part of that work that we need to do is integrate those services to make it easier to access. So that work is also underway. So those two pieces go hand in hand. Yeah.
Thank you. So I have another question from, that came online. How is the Public Health Administration going to implement modern, accurate communication systems like text, email, online messaging, etc., to replace telephone calls and voicemail, which result in miscommunication, errors, and delays? Thanks, Kathy.
Yeah, another great question. So how does the healthcare system get to the 21st century in terms of our communication tools? We have started to use some automated, again, phone messages, but it's a step for diagnostic imaging appointments this year. Diagnostic imaging or medical imaging appointments for MRI and CT. Government has put an investment and a focus in that area, and one of the things we want to make sure is if people have an appointment, they don't miss it. So automating those alerts and those messages, it's an important piece of that whole optimizing the efficiency of medical imaging. The truth of the matter is, though, we need to update our communication systems, and they're very expensive. We have a project underway which will help us automate or update some of our switchboard services that would allow some automated text capability. So that is coming. I also, just for the public's awareness, we on Vancouver Island have a patient portal, and it's called My Health Portal, and really would recommend people sign up for My Health Portal. It allows you to have access to your own information. You can also see in there when you've got appointments that are already booked, and we're working through that portal to have two-way communication. So that tool will be a critical tool in terms of empowering patients, giving them information, access to their own information. And so those tools are available now. And that's another way that people will be coming into the 21st century in terms of communication capability.
Right. It's quite a task, given where we've come from. Please go ahead.
In response to that, don't leave the people that haven't got $600 a year to have access to the internet, or they're getting old and don't want to learn the technology, leave them out of the loop like the government does. They try to force everything online, and they don't have, you can't go into Service BC, get someone without them having to print it out. Remember that there's people out there, either elderly or out in the country where we don't always have, you might only have dial-up. So don't leave them out while you're upgrading. Offer whatever way you can to improve things for the people who got it. Don't leave the other people behind, because the BC government has a habit of doing that.
Well, and I think that's an excellent point. There's not one size fits all. Not every patient has their own unique needs, and we have to design these systems to make sure we take all that into consideration. Yes, thank you for that.
Any other questions or comments? Go ahead, Leanne.
Is there any opportunity to open up the lab services in downtown Courtney again? It was closed during COVID, and it hasn't reopened again. I'm just wondering, probably staffing issues or whatever, but an opportunity, maybe?
No. Yes? Okay. It's a great question, Leanne. It's a question that we've received from this region consistently since pre-pandemic, actually, is access to outpatient lab services. So medical lab technologists and assistants are very hard to come by nationally. Here on the island, and actually here in this region, we've piloted a program where we've trained 20 people through the medical lab assistance program internally. So an earn and learn program, and they are about to be released into our workforce. We're really hoping with these additions that we'll be able to reinstate some of that outpatient access. So is it possible? That's our hope. I can't give you a date, can't give you a timeline, but that was the intention, is once we could build up that workforce and do some of that in-house training, that we'd be able to open that access back up again.
Great. Thank you. Any Other questions? Oh, go ahead, Doug.
Thanks very much. I have two questions. The first one, Dr. Enns talked about the social determinants of health and the importance of children and those first 5 years. And I'm just wondering how we're doing in terms of early detection, early assessment. I know that we've traditionally had challenges getting speech pathologists, hearing specialists, other specialists who actually do all that assessment work. And I know that we've got staffing issues in general. I'm wondering if we're doing any better in that regard. My second question is that, you know, we're seeing really significant innovation in relation to the dementia village. We're hearing about other innovations in our planning for healthcare facilities. But I'm just wondering if Island Health is putting any thought into how we, getting back to this chap's concerns about mental health, I mean, we have people on our streets who are neglecting themselves to the point that they're dying slow deaths, and there's a lot of people in the community who feel that we should be doing some sort of compulsory treatment for people who are basically dying because of their own neglect and, you know, the consumption of toxic drugs and putting themselves in harm's way and in many other ways. I realize it's a big question, but I'm just wondering if we have people who are putting their minds to whether we can deliver some type of care more effectively, given the fact that if you've got mental health issues, you can walk away, and you have to be pretty extreme for us to intervene at this point.
Yeah, you know, I've heard many people, including the Minister of Mental Health and Substance Use, call this a wicked problem, and it is a wicked problem. But there are all kinds of people and good minds putting their attention to it to try and figure out how to deal with it. But did I see someone back there was going to comment on it?
Leah, maybe I could ask on your first question, Doug, around early assessment. So childhood assessment, I know some of that got delayed with the pandemic. I'm just looking at Charmaine. Do you have any idea where we are in terms of reinstating the hearing tests that are being done at most of that's through the public health program locally. We could find that information out,
Yeah,
Doug, and get back to you on that. On the second point around, and I'm not sure if you're talking about mandatory treatment or if you're talking about what are we doing about, I would say, more long-term care for people who are impacted by substance use. Okay. I won't comment on mandatory treatment because that's a philosophical question, and I'm sure there's perspectives on that point, and I know as a family member I have a perspective on that point too, which is it's influenced by my own experience. I will say that what we are noticing, a cohort of our communities, our collective communities, young people who are impacted by chronic drug use, who are now requiring what would be considered long-term care. And so that is a new space for us to be in. Long-term care has always been associated as a seniors problem. And now we have young people who need long-term care. So my colleague, James Hansen, who's sitting in the back row, who leads the mental health substance use portfolio, the team is looking at what are ways we can put more extended care for what might be chronic brain injured young people, so that there's a treatment component, there's a housing component, and there's a improved quality of life. So we are in that business now. We haven't gone to the place of building facilities. For the most part, we're looking at partnerships. I don't know, James, if you would like to speak at all in terms of those kinds of programs that you're exploring.
Yeah, thank you, Kathy, and it is an excellent question, and I would say it's one that we're wrestling with across North America probably at this point. We do have two special population units, as we call them, one in Nanaimo and one in Victoria. To Kathy's point, that's where we're learning how to make our way in this space and work with the client base. So I think to Kathy's point, you know, we also work with BC Housing and we develop complex care services and so on, but I think it is an area where we'll probably be in the business of caring for folks much longer than we have before. So happy to talk after, but yeah, it's a space that we're in right now.
Any other questions? I just want to assure the gentleman in the front row that we heard what you said, and you said, are we taking it into account? Yes, absolutely.
I'd comment on the mandatory, the other part. There are people out there that, for the protection of society, should be held until they're more competent or willing to be responsible for themselves. That's, I don't know if that comes in. I'd rather the law didn't get involved because I've seen authority and their inability to deal with people with mental problems. They usually execute them. But the other part has got to do with just having the services available so when a person says, I need help, you've got somebody that can provide that service and show up and actually do it. So, because most of us, we can function day to day, but sometimes things come up, or coping ability, whether it's a counselor or whatever, that's what you need, and maybe you'll get through it. The other part, there's some of us that do need to be kept from the public until we're willing to be responsible.
Right.
Maybe I can just offer, you're absolutely right. Same-day access to care is challenging. Same-day access to care in any domain. That's why we're seeing our emergency departments almost overrun in every community, is that urgent, same-day, unscheduled access to care. There's almost no door that allows that except in an emergency department. We have piloted a same-day access to care mental health walk-in clinic in Victoria. That's one spot that we've got that ability to have that access. It's co-located, or it's in the same building as our rapid access addiction clinic, so that if somebody says, today I don't want to use, and I want to start with an opioid replacement therapy today, if they can come to that clinic, they're able to get treatment in that day. But it's not everywhere, and you're absolutely right. It is a need that we know exists in every community, that urgent access for care.
For what it's worth, Comox Valley system seems to be Campbell River. I got directed up there. Same day, phone calls were made, people were doing stuff. So you might want to check what they're doing in Campbell River.
Yeah, thank you for that.
Thank you. Well, if there are no further questions, thank you again for joining us this afternoon. As a governance board, we're accountable to you and the people we serve in the communities that we visit, and that is why it's so important to provide opportunities like this to hear from you. Thank you to everyone who submitted questions, who stood up to ask a question. Thank you to Kathy, Charmaine, and Sharon for your presentations. And we really appreciate that you joined us today, and for those people who tuned in on the live stream, thank you to you as well. So that concludes our public forum. Thank you very much.